Dr. Reinfeld, what's a facelift?
Okay, a facelift is the major building block, the core procedure for facial rejuvenation. Facial rejuvenation means making the face look younger, reversing some of the sagging that can occur with age, and it is something that involves the area roughly from the lower eyelids down to the neck. So whenever I think of a facelift, I'm almost always thinking of a neck lift, and in many patients who need a neck lift, I'm also thinking about a facelift.
Hey, Dr. Reinfeld, what's a deep plane facelift?
Yeah, a deep plane facelift is a procedure that I'm sure you guys who are looking into facelifts have heard about a bunch because it's really on top of mind for people right now. Now, a deep plane facelift is one in which there's minimal skin elevation. So, incisions are around here. And for what would consider a traditional facelift, we may elevate the skin all the way out to here. Deep plane facelift, it's a little bit more limited, and then we go into that deep plane, into the SMAS, deep to the SMAS layer, above the muscles, above the nerves, but in that healthy, really firm tissue that holds the fat pad here, the cheek fat pad, and allows a very strong natural lift that has long-lasting results. This is a procedure I've got a lot of experience with and I have been doing for many years.
Hey, Dr. Reinfeld, what's the typical age range for a facelift?
Oh, that's such an interesting question to ask right now. If you had asked me that question only 5 years ago, I might have told you 50 to 60. In the 50 to 60s with the rare patient in the upper 40s. But with a greater cultural acceptance of plastic surgery, cosmetic surgery, and even facelift surgery, with less self-consciousness in the patient, people who are younger, even in their 30s, upper 30s, and certainly in their 40s, are undergoing facelift procedures because there's no longer a negative stigma associated with it. When patients have the anatomy that can be corrected, many patients are seeking facelifts to sort of preempt future aging and certainly reverse the aging that their faces have accumulated up to that perhaps young age of 30 and 40.
Hey, Dr. Weinfeld, what's recovery like for a facelift?
Okay, so recovery. I like to break it up into a couple different categories. First of all, pain. How significant is the pain? How long does it last? Well, first of all, I don't even like to use the word pain. I like to call it discomfort. So, discomfort. Discomfort in many patients, in most patients, is actually a lot less than they think that it, or they thought that it would be. Okay? Many patients only take 1 or 2 narcotic pain medications and use non-narcotic pain medications for the duration of their recovery. Second thing is, when I'm thinking about recovery, is how long will a patient need assistance? Well, patients definitely need assistance overnight, the first night of the surgery, and I think it's best to have someone stay with them for about 24 to 72 hours after the immediate recovery phase, and certainly will need someone who can take them to their follow-up appointments, usually at 1 day, sometimes at 3 days, and certainly at 7 days. After 7 days, some patients may be able to drive, some may not. Now, I also think about return to exercise. Well, it depends on the other procedures that we're doing and the particulars of particular patient's anatomy, but patients can return to strenuous physical exercise sometimes at 2 weeks, but more likely at 3 weeks. Now, what about social reintegration? When can a patient who's had a facelift get in front of patients, not patients, but other people, and not feel as if people are wondering if they had a facelift? Well, first of all, that's sort of an internal thing, right? Like how they feel about things, how the particular patient feels about things. And so there's going to be some variation among patients based on just how they are, who they are, how their mind works. I would say that some patients feel comfortable, and this always amazes me, within 7 days, 10 days, getting out in front of people, going back to work, if you can believe that, and being able to interact with people, not feeling as if people are wondering if they had a facelift. Some people feel as if even up to a month, they're a little bit skittish, a little bit cautious about getting in front of people. Because they don't want to have it be detected that they had a facelift. So it's very variable. But again, some people return to work literally at a week. Some people may spend a whole month away from that. So it's a very different scenario for different people.
Dr. Weinfeld, what's recovery like for a facelift?
Okay, this is a really important question because people really they need to know this before they delve into having a facelift. Okay, so first of all, discomfort. Discomfort is less than people think that it is going to be. Many people only take 1 or 2 narcotic pain medications, especially if the facelift, the neck lift is the only procedure that they're having, and then go into having non-narcotic medications for the duration of the recovery. Number 2, help, assistance. You definitely need someone who's going to spend the night with you, the night after the surgery. I think it's best to have someone who can be with you for about 48 to 72 hours. You definitely will need someone to take you to your post-op appointment, your initial post-op appointment, which is usually 1 to 3 days. And I think you're also going to need someone who can take you to your follow-up appointment at 7 days as well when the stitches, the sutures are removed. So that covers discomfort, that covers assistance. How about return to physical exercise? Physical exercise, well, it depends. We want people up and walking right away, but what about strenuous physical exercise? Depends on the patient, their anatomy, and the particulars of their surgery. Some people can return to strenuous physical exercise at 2 weeks, believe it, 2 weeks. More people, however, are really in that 3-week to 4-week category for strenuous physical exercise, okay? Now, what about return to interacting with people? Well, obviously, this is going to be a very variable thing based on how people feel about what they think people are seeing in them. You know, like, is someone looking at me thinking that I had a facelift? You know, if someone's sort of more on the shy side, they may want to stay away from people for 3 to 4 weeks. But many people, and I'm always surprised by this, are getting out there at the 7-day time frame, even people going back to work, if you can believe that or not. So it's very variable. Some people early, some people can take a little bit longer than others.
Dr. Weinfeld, what's pricing like for a facelift?
Okay, that's always a challenging question. I'm not going to be able to give you a number, and the reason for that is that I don't know when you're going to watch this video. I don't know who you are. I don't know exactly what you need, so it's hard for me to say exactly what the price is going to be. But I do want to talk about price, what I want to talk about is what price means. I feel like patients sometimes focus and choose procedures based on price, and clearly price and money is important. You got to make sure you're choosing a doctor who has a service that fits within your budget, obviously, and when you schedule, we're very transparent about the price range that a procedure might fall in, and so that you know if it even makes sense to come in to see me for a consultation. But what I want to really talk about again is price and why we should really be thinking about value, right? Independent of the price, whether it's this or even a little bit more, and maybe more than those of other people, other options you might have in Austin. What I want to encourage you to do is, again, thinking about value. I want you to think about the experience that you're getting. I want you to think about the artistic eye. I want you to think about the pre and post-ops that you might see in my patients, the reputations, right? And here's one final thing I want to say, and that is that it's, right now in 2025, there's a lot of discussion in the popular media about the $100,000 or even $200,000 facelift. And I've been thinking about this a lot. What I want to say is, one, our prices are not like that. But what I do want to let you know is that you can get the $100,000 facelift in Austin. You don't have to go to New York. You don't have to go to LA. You can get it from me at a lot less than $100,000. So that's really exciting when we're thinking about pricing. So happy to see you. We can talk about the $100,000 facelift with the $100,000 results, and it's going to cost you a fair amount less than that, probably going to be in your budget, and I think you'll be very happy with the results.
Dr. Weinfeld, what other procedures go well with the facelift?
Okay, so first of all, let's reestablish one fact, and that is that a facelift almost always involves a neck lift, and anyone who needs a neck lift usually needs some element of a facelift, okay? So let's set that aside. One thing that I do in everyone, or almost everyone, who's getting a facelift is fat grafting. I think it's so important, so elemental to a facelift that I don't even charge extra for it. I just want it to be something that patients don't have any second thoughts about in having. So what fat grafting is using general liposuction, other part of the body, harvesting some fat, processing it very minimally, and then placing it back in its natural state in areas where volume has been lost. Usually the upper outer cheeks, sometimes along the piriform aperture in this area here to help support the nasolabial fold. There's other areas too, the temples can be very helpful, and then lips in some patients as well. So fat grafting. Then let's talk about the face and the neck lift, how that really treats from the upper cheekbones all the way down to the neck. But what it doesn't treat is the upper third of the face. So we need to talk about periorbital rejuvenation, or what some people might call an upper facelift. That involves a brow lift, upper lid blepharoplasty, lower lid blepharoplasty. Let's break that down a little bit. First of all, there are a lot of different ways to lift a brow. You can do a direct brow lift with some incisions just above the eyebrow. You can also do a subcutaneous brow lift with incisions that are hidden in the hair. But what I like to do in most patients, is an endoscopic brow lift. The reason for that is that it's very powerful, it's very comprehensive in the way that the other alternatives usually are not. And that involves small incisions here, here, and here, and then here and here, 5 small incisions hidden in the hair. We use an endoscope. That's basically a camera on the end of the tube, on a tube, that we can see what's going on in terms of the anatomy on a screen. And using that, we can dissect, reposition, loosen, elevate the brows, but also the temple tissue and the cheeks, all through small incisions. So I like the endoscopic brow lift. Upper lid blepharoplasty. It's usually removing just a little bit of excess skin in the upper eyelid, but also sometimes just a little bit of extra fat that's creating fullness, usually in the inner part of the eye, meaning like here. And then lower lid blepharoplasty. There's a couple of different approaches, but suffice it to say that the goals of all of the lower lid blepharoplasties are to create a more smooth appearance, less baggy appearance, less wrinkly skin, and fullness in the lower eyelids, independent of the type of approach that's used. So those are the procedures that are generally done with a facelift. Not in everyone, but with many patients.
Dr. Weinfeld, are there unusual procedures that you perform with a facelift?
Yes, procedures that are not done as frequently, but can be very, very, very powerful, very potent, are a chin implant. Chin implant when someone has a weak chin, to create a little bit more structure to the chin and the jaw to support some of that neck skin. And then something that I have a lot of experience with, something that I feel like I can uniquely bring to patients' overall results, is bony procedures such as an osteoplastic genioplasty, where we can cut the bone, reconfigure it, sometimes making the chin a little bit narrower, but maybe a little bit more projecting, or maybe a little bit less projecting, so that we can create a chin, let's say in a woman that's a little bit more feminine, a jawline that's a little bit more feminine, or in a man perhaps create a jawline that's a little bit more masculine. So those are options that can really enhance a facelift and a neck lift that aren't done quite as common as the others that I had described previously in this video.